In order to determine the stage of a patient's mesothelioma, doctors must follow one of several different staging systems currently being used to determine the severity of the disease. In order to create a treatment plan for mesothelioma, accurate staging is crucial. Mesothelioma staging can be defined as a process that is used to determine if and how far the mesothelioma cancer has spread outside the pleura or peritoneum and just how far the disease has spread. The 4 mesothelioma stages include Stage 1, A and B, Stage 2, Stage 3, and Stage 4. Stage 1 mesothelioma, the earliest stage, affects the outer layer of the pleura around the chest wall. It only affects one side of the chest. In Stage 1A, the mesothelioma may have grown in the pleural tissue that covers the muscle that separates the thoracic or chest cavity from the abdomen, the diaphragm. Stage 1B mesothelioma means that the disease is in the beginning stages of spreading to the inner pleural layer, but is still on one side of the chest. In Stage 2 of the disease, the mesothelioma has enlarged to form a tumor on the pleural tissue around the lungs, or it is already spreading into the lung tissue or diaphragm. It has spread to both layers of the pleura on only one side of the body. In Stage 3, the mesothelioma has spread to the pericardium, or covering of the heart, the chest wall, or the lymph nodes on the same side of the chest. Stage 4 mesothelioma is the most advanced of all stages. Stage 4 mesothelioma means that the mesothelioma has spread to the different parts of the chest wall. It may have also grown through the diaphragm and into the peritoneum, to the pleura on the opposite side of the body, to the chest organs, or through the inner layer of the covering of the heart or pericardium. Stage 4 mesothelioma may have also spread into the lymph nodes on the opposite side of the body, above the collarbones, or to other parts of the body. Doctors may use one of 3 different staging systems to determine the severity of mesothelioma. These staging systems include the Bouchard staging system, the TNM staging system, and the Brigham staging system. The Bouchard staging system was created by MD and cardiothoracic surgeon Eric G. Bouchard, and it is the oldest of all the staging systems. It is based on the magnitude of the primary tumor mass. While the Bouchard staging system has been around since the 1970s, it is still currently being used by many specialists for its advantage of simplicity and relevance to prognosis and therapeutic options. The Bouchard staging system uses the 4 stages listed earlier with similar characteristics. The TNM staging system was created by the American Joint Committee on Cancer. The TNM staging system is considered the major staging system. T stands for tumor, and it refers to the tumor size and how far it has spread to nearby organs. N stands for spread to lymph nodes. M stands for metastasis. This indicates whether the mesothelioma has spread to other distant organs. The TNM staging system assigns categories and numbers to determine the overall mesothelioma stage. The Brigham staging system is the newest staging system for mesothelioma. 52 patients were treated with trimodality therapy at the Dana-Farber Cancer Institute, Brigham and Women's Hospital Thoracic Oncology Program in Boston, Massachusetts. The Brigham staging system was introduced shortly after analyzing these patients. The Brigham staging system allows for 4 stages, and it is based on whether the mesothelioma can be treated or removed by surgery. It is also based on whether or not the body's lymph nodes are involved. The Brigham stages are similar to the TNM system. During the staging process, several tests and procedures may be used. They include a chest X-ray, a CAT scan, magnetic resonance imaging or MRI, and an endoscopic ultrasound. Chest X-ray involves an X-ray of all the bones and organs inside the chest. A CAT scan is a procedure that takes images from different angles of the abdomen and chest. Also called computed tomography, computerized tomography, or computerized axial tomography, CAT scan images are created by a computer linked to an X-ray machine, and in some cases a dye may be swallowed or injected, making tissues and organs easier to see. Magnetic resonance imaging, or MRI, uses a magnet, radio waves, and a computer to create detailed pictures of the abdomen or chest. Endoscopic ultrasound is also called endosonography. It is a procedure that involves the insertion of an endoscope, a thin tube-like instrument with a light and a lens for viewing into the body. A probe at the end of the endoscope bounces high-energy sound waves off internal tissues or organs. This creates echoes, which form a picture of body tissues. The picture of body tissues is called a sonogram. Endoscopic ultrasound may be used to help guide a fine needle aspiration or FNA biopsy of the lymph nodes and lung, as well as other areas of the body. Once the stage, type of mesothelioma, and overall health of the patient have been determined, the doctor will explore the various treatment methods. The treatments and methods used for treating mesothelioma can be divided into two types: traditional mesothelioma treatments and new mesothelioma treatments. Traditional mesothelioma treatments include surgical procedures such as pleurectomy decortication, extrapleural pneumonectomy, pleurodesis, and peritonectomy, along with chemotherapy treatments with intravenous anti-cancer drugs and radiation therapy or radiotherapy. New mesothelioma treatments include gene therapy, photodynamic therapy or PDT, immunotherapy, intensity modulated radiation therapy or IMRT, and the development of new chemotherapy agents. In addition to these new mesothelioma treatments, there are several other radical treatments available, including angiogenesis therapies, anti-neoplastin therapy, mesothelioma clinical trials, interferon and interleukin therapy, and radiofrequency ablation. Thank you for watching. This video was produced by Asbestos.Net, a leading resource on all aspects of asbestos and mesothelioma. Our priority is to inform victims about the devastating effects of asbestos exposure, mesothelioma, asbestos cancer, asbestosis, and other asbestos-related diseases, and to advise them with a wealth of information. Individuals whose lives have been touched by mesothelioma have numerous questions and concerns. Their caregivers and family members also need accurate, reliable information. If you or a loved one have been diagnosed with mesothelioma or asbestos cancer and need more information, we invite you to visit and explore the thousands of pages of oncologist-reviewed material on Asbestos.net, to call our convenient toll-free number shown below and speak with a mesothelioma specialist, or to use the simple contact form found at Asbestos.net to request a free copy of our informative books, custom inserts, and DVD. Asbestos.net. Information and help for patients and families.